Okay, I think I'm coming in. It looks like I got more people coming in than I have, but the next group, they're going to get me straightened up here on the screen. So as long as they don't chop me off, our next panel will be our discussion with our industry partners. And I see them, and I know we're getting a mix of my last panel. So I just want to make sure as they're letting everybody in, I should have, let me make sure I'm looking at this, Ms. Andrews, I think Emma Andrews from Pfizer, from Telix Pharmaceutical, Ms. Elizabeth Leff, in terms of patient advocacy lead, and for Ms. Andrews was Vice President of Global Patient Advocacy. In AstraZeneca, Ms. Josefa Marie Briceno, U.S. Medical Affairs Franchise Head. In Astellas Pharma, Ms. Deanna Holmes, Associate Director of Patient and Partnerships. And then I have from Johnson & Johnson, Dr. Jennifer Phillips, the Group Medical Director. Did I get everybody? It's so good to see you all. So good to see you all. My goodness. And let me tell you, I just had a really great time reading these bios. Man, I am outnumbered all over the place. I told people when I started with Finn, I had some hair on my head, but now you can see what happens with the work that we do. It's gone. So, but if I had all the power in the minds and the brains and the backgrounds that I've read in your bios, I'm just really blessed. I think this might be the first time on my community partnership program that we have for Finn that I've had my sponsors. And I talked with our president, Mr. Fair, and I said, you know what? I gotta see, I wanna know. And Ms. Leff know. Many of you, y'all had people follow me around like it was the Ringling Brothers Circus. And I would say, Adrian, where we going next? Where's the rally going next? And I was like, oh Lord, I haven't even finished that. Are we going here? And so I said, what is the excitement? What is this beauty? I want to find out myself because, as Liz knows, they're about to wear me out. Sometimes I haven't even got to my church yet. But I am so grateful, Astellas, so many of you who have been involved with us, supporting our efforts at Finn. And I think it's very critical that you participate in this discussion. And I must just say, with Jayla and others, soon as I said sponsors, when they sent that note out to see if you want to participate, your answers came back in right away. I'm like, woo, Lord, what's going on here? So I don't want to kill all the time that we have. And I'm glad to say that our founder is the one who put my questions together for me, and I got to get my sheets together. Y'all have to forgive me because he had those for me, and I want to make sure. I think we at least sent those out to you, but I'm somewhere in here making a mess about my questions. Let me find them somewhere. Please forgive me here. I had them, but I'll start off. Where are those questions? Come on. My assistant. Okay, here it is. I got it. So I won't pick on you yet, Ms. Leff, because like I said, I've seen you everywhere. And some of the others I've seen, I know Johnson Johnson, the young lady was down in Florida with me. They was in Newark, and some of y'all, Astellas, just all over. Pfizer, please. Let's don't talk about AstraZeneca. All of y'all have been just so great. I'm going to start off with you, Dr. Andrews, if you can. The question is, how does increased prostate cancer awareness and outreach support your organization's goals?
First of all, thank you, Reverend Backus, for having me and for convening this special summit. It's really very, very important that we're here today, and I'm really pleased to be part of this conversation. So to answer that question, perhaps I can start with our purpose at Pfizer, and the reason we exist as a company is to bring breakthrough medicines and vaccines that change patients' lives. And that means not just some patients, but for all patients. So with that, I say increased prostate cancer awareness and outreach is important and supports our organizational goals. And the first thing that comes to mind is disruption of health inequities. I don't have to go through the data here. Everyone is well aware about the increased risk of prostate cancer among Black men, as well as the increased mortality with Black men. So again, when you reduce health disparities, we bring those numbers down, aligned with our purpose as a company to bring breakthroughs, medicines, and vaccines that change all patients' lives. And then another thing that comes to mind before I pass it off to the other panelists is if we do this, we're going to drive better outcomes. If we increase awareness, people can get the treatment earlier or get into their diagnosed earlier and treatment earlier, we will improve patient outcomes. And then lastly is around connecting the science with our audience. If we increase outreach and awareness, we hopefully share information about the disease, information about treatment in a manner that patients can understand, which leads to empowering patients. And we know that if patients are empowered, they'll show up differently. They show up differently when they meet with the healthcare professionals, and that way they can really have a shared decision making. And also not only just the patients, but as I heard in the other panel, caregivers are really very important as well. So again, when we bring the science to life with patients or their families, we will improve outcomes, we will improve diagnosis rates, we will improve lower mortality rates, et cetera, and make sure that everyone gets the treatment they need or even prevention in some cases as well.
That's
I'll
phenomenal.
pause there.
That's great. I think that one of the things I know with Pfizer, when we had our town hall meeting at the home office there was a lot of excitement. People got on trains and they were calling me. Someone was saying, I'm supposed to be in this place. I said, oh, yeah, you're on my list. And then they begged me to say, please put me on the list.
Yeah.
One of the things that I also know is that for some of the organizations, it's my understanding from Dr. Crawford and certainly from Mr. Farrington, that I think Pfizer, I know we've had a program where you've also used some of the information we have for your employees in terms of
Exactly.
setting up employment information that we have to be shared with employees at your offices. And some of the other companies have done that. And so it's great to hear what you're saying. I certainly have had some good friends to travel along with me.
Yeah.
But thank you for your comment on where we are. Dr. Josefa Briceno, please enlighten us and tell us what is it, what are some of the priorities that you would like to see accomplished through community outreach at your organization or where you are, please? What are some of those for AstraZeneca? That would be very helpful to know.
Sure, and I'm going to give you four. I know priorities by concept is one, but I think we need to be more holistic. So priorities for us, screening and biomarker, and I will elaborate. Screening and biomarker testing, very important. Emphasis on caregivers, and you've been talking about this for a while, extremely important. Allow, empower patients to advocate for themselves. It's good to ask for second opinions. It's good to ask questions, challenge your doctor, and build trust on research and clinical trials. So let's just break these out a little bit. So when you talk about screening and biomarker testing, right? Beyond the basics about getting screened, going to the doctor if symptomatic, losing that taboo of talking about symptoms of prostate cancer. It's about asking about biomarkers, right? You've got patients with advanced prostate cancer, patients that have certain high risk features. You have to do genetic testing because that will determine not only the treatments that they're going to get, but also it impacts the family because there may be some genetic alterations that are, passed on. And one example of that is BRCA, right? So that can lead treatment decisions, can make your sons, your daughters, all be aware of their health. So outreach should help patients and families understand what the tests are, who should get tested, and they need to feel to be empowered to use those results, right? So the trusted community organizations are really going to build that trust, that knowledge. That's one. Caregivers. The caregivers are so critical. Somebody said it before. You guys, man, and it's not to be stereotypical, but you're tough. Like you don't want to go to the doctor. We have to like really, really push you guys. So then caregivers, we need to build their knowledge base because if you have an empowered caregiver, they're going to be a strong advocate. The caregiver can make it or break it when it comes to clinical trials because if your wife trusts the clinical trial and the doctor, it's quite likely that you will too, right? Second opinions, you've got to normalize that. You've got to be able to teach the patients that they can advocate for themselves. They can question the doctors. And then the other piece is clinical trials. And when we talk about clinical trials, of course, the word equity comes here. Because what's happening right now with our trials, the percentage of Black patients in the clinical trials is single digits. And how are we going to bring medicines to patients when those medicines haven't been studied on people like us, for example, right? So that is also very important. Partner at the community level to create education about clinical trials and drive trust. So those are the
I
four
like
things.
I like that last statement because many of you who are up here or your representative, as we go along with many of these sessions that we've had, our educational symposiums at the church, you were on these panels on the matter of clinical trials. So you've had a direct, some of you have had a direct experience through what we've done in these different areas of asking the questions and hearing the questions that the potential patients or other loved ones had in these sessions that we've had at the church. And clinical trials was definitely one of those key ones. And so that I have seen that has been very, very effective because it provided educational information that would help assuage some of the anxiety that many of the people had in the audiences that we were in. And Dr. Crawford made sure of that as he ran those three. Let me have, Dr. Jennifer Phillips. I can tell you, Lord knows, I remember going to Florida with one of your representatives, and I think Mr. Farrington and I were even in New Jersey with one. There two that were at some of our events. Tell me again, in terms of your organization, uh, what are some of your priorities and what recommendations might you have for Finn to enhance our community efforts?
So much. I've been so impressed with all of the talks that you've had and, straight to the streets. I think Fenn has a great number of resources. J&J has a great number of resources like shared decision making and other information. J&J with me, which is for both the patient and the caregiver, which has things like Dr. Brianka mentioned as far as shared decision making, being able to ask questions. What are some of those questions? So having the resources is great. And I know Dr. Crawford has this whole session on clinical trials, which also is very important. We've had a lot of the J&J studies on your dashboard, but if you're not aware of them, you can't access them. So what you're doing is critical. The biomarker testing is critical to having the right treatment to the right patient. We know we've been doing this for breast cancer and lung cancer. Now we have to do it for prostate cancer. We have a very, very lofty goal at J&J, which is to eliminate cancer. But if you aren't tested and you don't get the right treatment, we can't do that. And just as a separate plug, I know that this is prostate cancer, but yesterday we had an approval for bladder cancer with an innovative drug delivery system. It's called Inflexo, and it is available now. So I think we do live into our mission of trying to bring innovative medicines, but getting them to the people is critical.
Hmm. Well, that's a very important point in terms of not only what's available or getting people involved in clinical trials so that some of these medications, I'm learning a lot from Dr. Crawford, Mr. Farrington, and all in this whole area. I'm not in the medical space myself, but what
Dr.
the points
Crawford is brilliant.
yeah, some
You
of
should
the
listen to
points
him.
that you're raising are critical because I have been in meetings and when they're talking about specific pieces of medicine for specific people, if we don't have the data to support the kind of things that can be made to support some of those illnesses, it becomes very key. So I appreciate what you have said. I thank Ms. Deanna Holmes. Oh my goodness, there got to be. Let me
Oh,
look at my thing and make sure I'm saying Astellas here. Listen, your
yes.
organization came up in a discussion thanks to Ms. Brown of what's happening in Chicago. I think when I came, I remember talking to so many people, Astellas, and some would say, "Well, we belong to this church, or we belong to that church." That's another thing. And so I stuck in there tell us about what Astellas is doing. We did hear, it's interesting that we had Ms. Brown up there from Chicago who mentioned your name and others in terms of the partnership and that could be supportive in what's going on in Southside Chicago and other places. But what what does the increase in prostate cancer awareness and outreach support do for your organization, and what are your priorities, and why would you be asking me where are you going next and where should we be? Since I got to start looking at the trail for 2026, I've got to
We're
get
already there. We're
some new
already there.
shoes or something. So tell me what my marching orders will be. It's good to
Yeah,
have you here.
I would love to. I would love to. And similar probably to everyone else on the call, we are already planning for 2026. So we're ready. We're ready. Well, thanks. Like someone mentioned earlier, thanks again for hosting this panel and kind of bringing us all together to have this discussion. And I would say, so what we're focused on really at Astellas is really kind of getting around this idea of hard to reach patient populations. And in my perspective, there are no hard to reach patient populations. We're just not showing up in the right places. And so the work we're doing with our Community Health Insights panel, that includes Angelina Brown, several prostate cancer patients and survivors. We've also brought in representation from the payer side, representation from local health systems to kind of figure out how do we need to show up in these, again, hard to reach communities or patient populations. Are we speaking the same language? Are we, showing up at events that are meaningful where people are going to be able to engage and interact? Are we doing the things that we need to do? And so for us, that's kind of where our priorities align, in addition to some of the things that have already been mentioned, of course, in terms of clinical trials, making sure that we have representation. I know at Astellas and probably at all the other organizations as well, bringing that patient voice into the development of clinical trials. And so we need to have a voice at that table to make sure those clinical trials are easy to access. There are quality of life things that make it easy for people to stay in clinical trials, and the information to enroll in clinical trials is going out to the right places. So we have a number of different priorities. I'll just mention those. I don't want to take up too much time.
That's okay.
I will say one of the things that kind of I like to say lives rent free in my head, it's been mentioned a little bit, is how do we get prostate cancer kind of on that same level as breast cancer, in terms of when you think about women and breast cancer at a very young age. We know what age you have to start getting mammograms. I mean, years ahead, we're thinking about it. We know people who have breast cancer. We're talking about it. We're in the sister circles. We're celebrating with everybody when they come through those journeys victorious. How do we do that for prostate cancer? So from something that we've been talking a lot about at Astellas is how do we reach kind of that younger generation of men who will be patients in the future, because we know it's coming. Prostate cancer impacts so many men. We know that for some of them, it is coming. And so how do we get them on board with the idea of prostate health before they get cancer? Because inundating people with information once they've got the diagnosis is overwhelming. It is just overwhelming. People are saying things and it sounds like womp, 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 womp. But if we have an opportunity to catch those individuals ahead of time with PSA screening, so driving home that point of knowing your number, and if it changes, these are the things that you do before it happens. How do we do that? So that's kind of where our thoughts are, where my thoughts are personally at Astellas, and I think Finn is doing a great job of doing that. I'll share this anecdotal story. When Finn was still doing the plays in different cities, they came to New Orleans. My family's from New Orleans, so I went down, called all my family, said, "You guys are coming to a play. We've got plans this weekend." And one of my relatives brought his 7-year-old grandson to the play. And after the play, his mom called me and he was like, "What?" She was like, "What did you guys go to?" Because he came home saying, "Mom, we've got to tell Dad about prostate cancer." And it just gives me goosebumps every time I think about that story and relive that. So, Finn is doing a great job. And really, as we're talking about 2026, certainly what can we do to help continue to support the great work that Finn is doing?
Well, I was with Mr. Fahrenheit. Again, that was another Ringling Brothers Circle show. Where's the play going next? And so I was down there with him in Louisiana. That was another one of our projects. And families that fit in those seats 1,000 at a time to get the information. And you're right, young people did get involved with that. I think what you heard today from some of our guests too is what their angles are in terms of engaging younger men in the discussion to provide education. Even you heard that from Dr. Bodrick in his comment to Thomas, and you'll probably hear it in our last session too. May focus on that. So you're right. Finn is looking at the whole gambit of what can we do to save lives, but more so educate at earlier ages. And so again, thank you. I suspect that when Ms. Brown educate me about what stepping is, you'll show me how to do it from Chicago, since y'all will be working together down there. So I expect that
Yeah,
we'll be doing something with those 20,000 men up there stepping. I'll find some kind of way. I don't know if I'll be in step.
I don't know. I may have to set that out. I'm originally from Louisiana, so I can do a
Uh-oh.
second line.
All
If
right.
you want to, have a
Well,
party in the street, we can do that. But
all
stepping,
right.
leave that to the Chicago
We're
natives.
going to do something to get those 20,000. And Lord knows, thank you. I need to talk to Ms. Elizabeth Leff. I know when the last time I saw her? It was June, I think. And she, bless her heart. Can you please tell us what are some of the priorities, please, for your organization, and what recommendations you might have for us? Because you certainly have been with us in a lot of places. Certainly, I was dragging everybody around from January to about June or whatever. Y'all were busy. But please tell us what you see that could be very helpful to us and actually be helpful to hopefully other sponsors who may be online today, that there's a learning opportunity here. And if we, as you said, Ms. Holmes, if you're really being engaged with those communities that certainly need the help and the hope, I think that that's what's key right now. And I thank God for your efforts and that you're not giving up. This is about issues of life and humanity. And I really, truly believe that. I hope and pray that every faith house in this country, certainly the African American faith house, at least with the issues that are going on in this crisis, will do this men's health ministry like you're having with people. That's been our goal. That's been certainly my goal in coming on with Finn. Okay, I'll be quiet, Ms. Leff. Let's go, because I need at least one question from my audience.
Thank you, Reverend Backus. And I've spent a lot of time with Fen, and Fen is now family for me. I've traveled all over the country with all of you, and I work with a lot of patient advocacy groups, and sincerely, I have enjoyed so much working with Fen. And yeah, Fen is like family. A little bit about Telix and the first part of your question. So our goal, of course, is to help people with prostate cancer. We want them to survive, live longer, and have better lives. And we're doing that currently with our targeted radiopharmaceuticals. We have our PSMA PET imaging scan and our targeted radiotherapy. And I bring that up because the more people that know about these innovations and options and get screened earlier and know that they have a voice in the conversation, the better it is for them to be able to take control of their care and have better outcomes. Telix is all about the patient first. Our CEO says it every day. We mean it. It's all about the patient. Now, for the other part of your question, what recommendations would I have for Fen? That's tough. You guys do exceptional work. And what I would say to that is keep up the work that you're doing. It's very, very vital work. Especially, you're a very trusted organization in the community. The church rallies I've attended, they're incredible. I bring back so much information to my organization, the statements and quotes and all the things that these men are saying. It's just truly remarkable. It's really impacting the lives of men. So many men don't want to speak up, but when they get to your rally, I see even during the course of the day, they start talking and they start feeling more comfortable. Continuing supporting survivors and, of course, caregivers. People have mentioned that, but the caregivers are very important. Continue with hearing their stories and getting their stories out, because that resonates and motivates other people with prostate cancer into action. I hear so much men didn't want to say a word, didn't tell their wives, didn't want to talk about it. And then they went to a Fen rally and they started spilling. So continue to help make it easy for people to get PSA screenings, which you do at your church rallies, which is amazing. A lot of people don't even know what a PSA test is. If you recall one of the church rallies, I dragged in an Uber driver to get screened because he said he didn't want to do it. He was too afraid, forced him in, not forced, but gently asked him in. And he got screened, and continue to partner with industry. You know, we really want to partner, and we really want to make, I think one of the folks on the panel mentioned, get rid of this disease. And the only way we can get rid of this disease is if we all work together and we partner with patient groups like yourself. So.
Well, thank you. I want to say thank you all. I see Mrs. Miller's on, and I'm sure we have some question, Ms. Miller, for this great, phenomenal audience and these panelists. Can you share
Yes, we do. The first I will share is just from our own FEN ambassador, Dr. Artie Shelton. He says, as a prostate cancer survivor, I thank the sponsors for their support in the fight against prostate cancer, Dr. Shelton. And then just a follow-up along the lines of what Deanna was talking about. What is the best way to reach out to younger men, in your opinions?
Maybe I can take that on. And first of all, I think FEN is already doing, like everyone said, a phenomenal job in terms of getting the message out to the communities. And it's just really maybe amplifying your digital storytelling in terms of, maybe creating shorter videos to really reach those younger audiences and putting them where they go for information, on making sure those videos are available on social media and formatted for social media. And also looking at who are the people young men look up to and bring them in as speakers and to be able to engage with young men and really meet them where they are and really where our young people are, usually online. So to me, I feel like everyone said, FEN is doing a phenomenal job. And how can you amplify your message and maybe format it a little differently to reach that younger audience?
Great. Any other messages, Ms. Miller?
I don't have any other messages in the chat.
Okay.
I also think it's been phenomenal that a lot of the sports players have spoken up about their own journeys with bladder cancer, with prostate cancer. I was lucky to meet, I grew up in Pittsburgh, and so I have to be a Steelers fan, but I met Robin Cole, who is a survivor who speaks, gives regular speaking events in Pittsburgh and around the country. So I think that's also very important as far as reaching younger people.
Well, I want to end this session with you by saying that many of you, in my ride across the country with what is going on, I've learned a lot about you and your representatives. And I know at least 2 or 3 of you have personal journeys with cancer in your families, children and uncles, and the passion that comes from that I hear as to what allowed you to go in this profession. Many of you, is the piece that resonates with what we do. People who have that passion and do understand the need for survival and support of humanity. I appreciate you all for what you do, and thank you for supporting us. And we look forward to continually working with you. And I'll figure out where I'm going for 2026. But God bless you all, and thank you for being here today. Your contribution is tremendous.
Thank you.
Thank you.
Thank you so much.
Bye-bye.